Has it ever happened to you that even though you brush your teeth, use dental floss, and follow all your dentist's instructions, you still have bad breath? Maybe someone has told you, for example, that your bad breath comes from your stomach or some internal organ. And that could be true, but it's also very likely that your bad breath is coming from your throat, caused by something called tonsil stones. Now, where does that funny-sounding name come from? What exactly are tonsil stones? To help us understand that, I invited a throat expert, the otolaryngologist Dr. Fermin Subia Urgomar, who is better known as Doc de la Voz. He's an expert on the subject, and in this video, he's going to clear up all your questions, from whether you can remove them at home, to what kinds of surgeries are needed when they can't be removed at home. Doc, welcome. Thank you so much.
Hi, Fede. Thank you for the invitation. I'm really happy to be here on your channel.
Doc, can you explain to us what those tonsil stones, better known as tonsilloliths, are?
Well, it's actually a very interesting topic, to be honest, which happen to a lot of people, are accumulations of a combination of substances that can include bacteria naturally found in the throat, traces of saliva, and sometimes tiny bits of food. All of these come together and form like little stones. They mineralize and form a kind of small stone that accumulates specifically inside the tonsils. And the tonsils are structures that we can all see in the throat, which have little crypts or pockets. And that's where these little stones start to build up and remain lodged. The little stones or tonsilloliths can come out little by little, and that's when you might see them, but sometimes they don't. They stay lodged deep inside, and the only thing they cause sometimes is simply bad breath.
Excellent, Doc. Hey, are they common in most people?
Well, not everyone develops tonsilloliths. It's estimated that around 10% of the population has tonsilloliths. That means 1 in every 10 or 10 out of every 100 people might have them. But what does it depend on, or what could be a risk factor for developing them? It's generally associated with having tonsillitis. Very large ones, because if you have very large tonsils, generally these caves or crypts, which are present in everyone's tonsils, tend to be a bit larger and deeper the bigger the tonsils are, and so they tend to accumulate these stones a bit more. So let's say it's more common the larger your tonsils are, and larger tonsils also make people a bit more prone to infections of the throat. So recurrent throat infections are associated with a higher presence of tonsil stones, but this is related to the size of the tonsils. That doesn't mean that everyone with large tonsils will develop tonsil stones, nor that people with small tonsils can't have them, because there are people with small tonsils but with large or deep crypts. So it can happen with either of these two sizes, but generally speaking, people with large tonsils are more likely to have them.
Very interesting fact. And you know, people often ask me on the channel whether they can remove tonsil stones at home or if they need to go to a doctor to have them removed. What do you think?
Well, this is something everyone wonders about. How can you remove them? Look, there are people who have figured out how to do it at home. I mean, I've had patients tell me stories about using paper clips, pens, cotton swabs, right? They use a Q-tip, insert it in there, and they already know how to remove it in such a way that it comes out. That's fine as long as you don't hurt yourself. But the problem is that if you don't have it very accessible, and if you're one of those people who puts something in your mouth and starts gagging, every time you put something in your mouth, you won't have much precision. And then what can happen is that you might hurt yourself. And that injury to the tonsils can lead to an infection. So in general, unless it's really easy to reach and you've already figured out how to do it, those things usually tend to come out on their own. But if you can't see it clearly, think it's too deep, or you've already hurt yourself, if you've already stuck something in there and there was a bit of bleeding at some point, then ideally a doctor should remove it for you in case it's not easily accessible to you. What do doctors do? Well, we use a very thin, very fine instrument, and sometimes we even apply a bit of local anesthesia to be able to manipulate and remove that little stone. But even then, sometimes it's impossible to do because they're too deep or too far back. Or, as I mentioned, the patient won't let us because they have a very strong gag reflex.
Yes, I've had people ask me if they can use a cotton swab or some kind of tool to remove them. And look, what you're saying about going to a doctor makes a lot of sense, but wouldn't you agree that you remove them and then 3 or 4 days later they can come back again? For those people who constantly get tonsil stones, wouldn't there be a better solution? Well, surgery, removing the tonsils.
Exactly, yes. That's a good question, Fed. Because in many cases when they keep coming back, even after you've tried removing them with whatever you have at home, or you've already tried all kinds of gargles and products that you can actually find online, which supposedly get rid of them. The truth is that if you have very deep crypts and you're forming them, it's going to be very difficult to eliminate them completely. So that's exactly when the definitive solution is to remove the tonsils. That's done through surgery, under general anesthesia, and well, it's a procedure that is carried out with complete safety. But the only definitive way to completely remove the crypts is by taking out the entire tonsil. For a while, a technique was widely used. It's still used occasionally, but has fallen out of favor, called cryptolysis, where a laser was used. This was done with local anesthesia in the office, and if you had one crypt here and another one right next to it, in theory, the laser would merge them into a larger one, and theoretically, that would prevent debris from accumulating there as much. The problem is that over time, we realized that the little stones, or tonsilloliths, kept forming because the crypt or cavity extends all the way to the bottom of the tonsil. It's like a very deep cave. So even if you make it very wide on the surface, those two channels still go all the way down, and patients continue to struggle with bad breath or halitosis over time. So the definitive way to eliminate this bad breath, if this is the cause, is by removing the tonsils. And it's one of the definitive indications among all the existing reasons for tonsil removal. One of them is precisely bad breath.
Perfect, doc. Hey, but tonsillectomy is usually more common in young people, right? In children. So what would be the contraindications for performing this tonsil removal surgery in adult patients?
Well, the contraindications for performing a tonsil surgery are mostly the general contraindications for any patient who has a health issue, especially related to blood clotting. And for that, preoperative lab tests are done, just like with any surgery involving general anesthesia. A checkup of various blood parameters must be done, especially, I emphasize, the issue of coagulation. And as long as those parameters are fine and all the preparatory tests are in order, it's really a surgery that can be done without any problem, and it's an outpatient procedure, meaning that the same day we perform the tonsil surgery, you go home that afternoon, with medication and without any major issues.
Excellent, doc. Hey, and what advice can you give to patients who have bad breath and suspect it's due to tonsil stones?
I think the advice would be, if you're someone who you already notice that your breath smells strange, or someone has told you, like when you're talking to someone and they start to turn away a bit, or your family members have already said, hey, something seems off with your breath, then you need to rule out several things. Could there be a gastrointestinal issue causing bad breath? Yes, it's possible. So that aspect needs to be ruled out. Could there be a dental issue that's causing your bad breath? Without a doubt, it's one of the main causes. Fede, you'll back me up on this. But if you've already thoroughly analyzed, studied, and ruled out that part, and you still have your tonsils and they're large, don't rule out the possibility of addressing that. So in that regard, my recommendation is to get yourself checked. Go to someone who can examine your tonsils to see if you have large crypts, have them take a look. We use cameras inside the oral cavity to look at these crypts, both at the bottom and the top. They're the same cameras we use to examine the entire neck area, the pharynx, and the larynx. And we can see in great detail whether that could be the issue. So the recommendation is get checked, go see a specialist so you don't keep dealing with that problem.
Doc, excellent advice. Let me tell you that I met Dr. Fermin because he operated on my vocal cords. I lost my voice and was practically doomed to never speak again. He removed a polyp from my vocal cords. By the way, I'll leave the video up here for you to check out. It's very interesting, so you can learn what not to do to avoid ending up like I did. And doctor, please share your social media so people can follow you on your wonderful channel, because you really do give great tips on maintaining and taking care of our precious voice.
Fede, no, on the contrary, thank you so much for inviting me to your amazing channel. I'm a fan, I have to say it. And on the contrary, I'm happy to interact with anyone who wants to. You can find me on social media as Doc de la Voz on Instagram and Twitter. You can also check out my YouTube channel, which is Doc de la Voz. And I talk about many things related to my greatest passion within otolaryngology, which is the care and treatment of human voice problems. So thank you again, and many greetings to everyone.
No thank you, and well, go follow the doctor. And if you like this video, subscribe to my channel because it's information meant to help you and benefit your health. And don't forget to discreetly share this video with that friend of yours who has bad breath and whom you'd like to help. See you in the next video, and take very, very good care.